Hi guys, welcome to our YouTube channel. I am Dr. Jones.
And I'm Dr. Chi, and on today's episode is Ask the Doctor.
So if you follow us on Instagram, you'll be very familiar with our Ask the Doctor segment. There are quite a number of questions we've not been able to answer. So today we're going to be answering that on YouTube. So let's just dig right in.
First question. I use Lysol during the day and benzoyl peroxide at night. Now that my acne is gone, what can I do?
It's awesome that your acne is under control. You can maintain the same routine. However, I would advise that you schedule an appointment with your practitioner and get a proper review done. Question 2. Does the Clarity Pill cure both melasma and hyperpigmentation? Dr. Chi.
Melasma is a subtype of hyperpigmentation, and melasma has no cure. Topical products which can be prescribed with some in-clinic procedures like Clarity Pill can help put it under control. Okay, next question. I have shaving bumps but not in Nigeria for clinic procedure. What can I do?
Great. We have online consultations and would recommend you do this. That way we'll be able to assess and maybe start up your program. And then whenever you can come into Nigeria, if you do need in-clinic procedures, then you can come right in. When are you guys doing something in Ghana?
We have an outlet in Ghana, so you should try and visit and book an in-clinic section, okay?
The clinic is up and running.
Next question. What's the best recommendation for minor dark spots, in brackets, spots from pimples?
Okay, so this is PIH, post-inflammatory hyperpigmentation.
You should look out for products that contain actives like alpha-arbutin, licorice, vitamin C, and also chemical exfoliants like the alpha-hydroxy acid as well.
The next person has no question, just a shout out to the doctors for being amazing. Oh, thank you.
What type of treatment do people with sebaceous hyperplasia need? Sebaceous hyperplasia has to do with hyperactivity of the sebaceous glands that triggers or causes a lot of sebum to be produced. So you need products that will be able to regulate sebum production, like the alpha hydroxy acids, and also you need the beta hydroxy acids as well. And maybe an in-clinic procedure like some laser treatments might also be incorporated as well to help. So the in-clinic laser treatment helps with the raised bumps on the affected part of the face or body, like the forehead, the nose, and the chin. Right? So next question. I'd like to start the process. Where do I start from?
Okay, a very good place to start would be a proper consultation where a treatment protocol will be mapped out for you. You can either do your consultation online or in clinic. So next question, is retinol good for all skin types?
Retinol is good when used correctly, period. There are different forms of retinol, and you should try and visit a skin therapist to assess your skin and recommend the right form for you to use. I have this hyperpigmentation on my brow line. Please, how do I clear it?
Hyperpigmentation has several different causes. So we need to first assess what the cause of your hyperpigmentation is. Were you born with it? Is it friction? Or is it post-inflammatory from your brow? Treating hyperpigmentation will depend on the cause and the severity. And that needs to be assessed before we can map out a treatment protocol. You can decide to check your proper brow size, since the hyperpigmentation you said is on the brow line, so that you're not causing more friction and more hyperpigmentation. And you can also use a soothing cream to calm the area as well. And most importantly, please do not use bleaching cream. Get the appropriate depigmenting agent from a recognized practitioner and you'll be fine.
Do you have a treatment for dark inner thigh? Yes, we do. We're going to combine products that contain alpha-tyrosine inhibitor, and we're going to combine that with some in-clinic treatment modalities too. Like maybe we could do a chemical peel depending on the severity and intensity of the pigment, and we could also combine that with laser therapy when needed. In most cases, the cause of dark inner thigh is as a result of friction whereby the inner thighs rub against each other. So basically what you can do to help prevent further deepening of the pigment is to wear tights. I hope that's what it's called, tights, okay, just to help prevent and wet trousers. While sleeping or when you're home, you can apply soothing cream on those soothing products on those areas too. Please, do you have any location in the US?
Presently, we do not have a location in the US, but we do offer online consultation from anywhere in the world, and we've successfully managed quite a number of cases. Also, we do have friends and colleagues in the profession who are in the US, and we could comfortably refer you to them if need be.
Hi, do you guys treat large pores, and how much would it cost? Also, how many sections? When we're talking about large pores, if it's genetic, there's little or nothing you could do about it. Treatments that we're going to use to tackle that will basically be just to improve the outlook. All right, and that involves multiple sections of micro needling, maybe topical agents as well. Then if the cause is as a result of clogged pores, we could do in-clinic sections like chemical peels too and laser therapy to help unclog the pores and help refine and improve the outlook.
Can chicken pox scars be reduced or cleaned, and what will be the costs? So this is a form of post-inflammatory hyperpigmentation. Usually it would require a combination of the appropriate products and the keratolytic products or depigmenting agents to use in that area to help to depigment it a bit. And of course, if need be, depending on the severity of the trauma you put on it when you had a chicken pox, you may need to come into the clinic, a procedure like maybe a chemical peel or even a mild laser treatment done on those spots. So yes, it can be reduced and cleared. On cost, we'll need to get back to you on that when you come in.
Next, does vitamin C serum clear dark spots on the face? Well, vitamin C belongs to the class of what we call the alpha tyrosinase inhibitor. It could help, okay, but when combined with other depigmenting agents, it works beautifully and gives an amazing result. But alone, it might not be that effective. Next question, I'm quite late. Do you guys treat dark spots on the legs, and what's the price?
Yes, we do treat spots in any part of the body, most part of the body. But this will depend on the treatment protocol we pick, will depend on the cause and the intensity of the pigment. Treatment protocols will definitely include appropriate products, depigmenting agents, and then treatments will be a combination depending on what we see of chemical pills and probably laser as well. So yes, we do treat that.
Yeah. I have a cyst on my forehead.
What kind of cyst?
What kind of cyst?
Did she say?
No.
Oh, okay.
No.
A cyst is simply a collection of
a fluid within a
particles within a sac. It's enclosed. That's why we say it has to be removed, because it now becomes like a foreign body. So it needs to be either drained or evacuated. So contents of cyst will include pus, blood,
and serous fluids, etc.
A cyst anywhere in the body has to be drained. So we'll need to assess the cyst and be sure it's not something that can kill you. But jokes apart, a cyst in any part of the body has to be drained. So we'll require you to visit the appropriate facility to get it assessed, to know what the cyst contains, and then this can be evacuated safely.
Please, do you work on stretch marks? And if yes, what's the cost?
Good. We do work on stretch mark. Stretch mark is simply a tear underneath the skin surface, and it appears as striae, either dark or light parallel lines on the surface of the skin, which makes it not beautiful for most women. That's why they want to get rid of it. Treating it will depend on how long it's been there. It may respond, but usually it doesn't ever go away completely. So we do treat stretch marks, and we combine protocols to get it treated. Things we can use will include microneedling.
Yeah, microneedling. Yeah, multiple sections, and we're looking at between let's say 6 to 10 or thereabout to help improve the outlook. But it can never actually go back looking as the way it used to be.
It will just be not so obvious anymore. So that way you can live with it comfortably.
Please, how much will it cost to remove facial hair completely? We're going to leave a link down below where you can actually have access to the price of our in-clinic procedures. This question saying completely is, how do we describe that? So we completely eliminate it.
Hair reduction will require laser sessions. Now, laser treatments usually will be done every month, once a month for at least 5 to 8 sessions. This will give you significant reduction in hair growth, and it becomes finer and thinner. It's not as bothersome as when you started. So, but completely, it doesn't work that way.
Please, how much is the deep nasolabial fold treatment?
So this is the area we're talking about when we're talking about nasolabial fold. For some people, there's a line there, especially for ladies, when they put on their makeup, it sort of sinks in.
Yeah.
So they don't like that and want it fixed. In filling the nasolabial fold, we use hyaluronic acid fillers. The cost, like we said, will be in the link below, but usually we could put in 1 or 2 mils on each area. And we should also let you know that this is not a permanent fix, because after a while your body also breaks it down, and in about a year you might need to touch up on it.
Can you treat dark skin tones? For example, my face is darker than my neck and chest. Yes, we can. But before we start, we would like to ask you questions like the kind of products you use. Do you also have sunscreen as part of your skincare regimen? That would help us know what might have triggered that situation for you. But yes, we could, and that will entail you coming in, whereby we'll have to assess and also put together a skincare regimen for you. We might along the line actually do an in-clinic treatment like the chemical peel, and might combine, if needed, laser therapy as well.
Please, what drug do I take to stop pimple from coming out on my face? I have taken some, but still no results. It is important you do not self-medicate when treating any ailment. Pimples or acne require a multidisciplinary approach to treatment. Your pimple may not need drugs to treat it. If there's no component of acne that requires drugs, then there's really no need. It's better you visit someone who knows how to actually take care of your acne, and then they'll find out the causes of acne and then treat appropriately. But importantly, please do not self-medicate.
Hi, do you have treatment for severe dark hands and knuckles? How much will it cost?
Every question on costs, we'll have a link below that will address that. So depending on what costs your dark knuckles and hands, some people naturally have dark knuckles and hands. We do not advise you should treat that.
Yes,
just
those genetic aspect. Basically, it's best you just leave it that way.
Just get emollients and just get it.
But basically, if the dark knuckles and hand is being triggered by some other factors, like we could actually
wrong product usage.
Yeah, we can actually combine products too, and the product will have alpha tyrosine inhibitors as the active ingredients in it. You have to use those products only at night. Yes, alright.
You can also combine with keratinolytic agents.
Yes, depending on how the texture of that area is as well. And daytime will just have to be sunscreen, yes, to just help further protect that area from further damage. And treating dark knuckles and hand is a little bit tricky. It is, and for that reason, it takes like a longer duration for us to really get perfect results, and we're looking at between 2 to 3 months for you to get that amazing results.
All right, that's the much we can take for today, and we've had so much fun answering this question.
Yeah. Don't forget to like, subscribe, and turn on the notification button. Where's the button? Here? Here? Please turn it on.
So we'll see you next time. Have a lovely, lovely, lovely time.